Birmingham East and North PCT has launched Birmingham OwnHealth, a telephone-based outreach service to support people with long-term conditions to improve their self-management. The PCT forged a strategic alliance with Pfizer Health Solutions and NHS Direct to deliver the service, which is already demonstrating improved health outcomes for its local population.
Birmingham East and North PCT is launching Birmingham OwnHealth because we've got a population of 440,000 and most of the population is highly deprived, lots of what we would term as hard to reach groups, and we needed to find a different way to reach into those communities and groups, and telephone-based care seemed like an interesting way of actually accessing those groups and giving them a different type of service which is personalised to them.
NHS Direct's role in the Birmingham OwnHealth service is to provide the care managers. Our care managers are highly trained nurses who have been given extra training in motivational techniques so that they can work with our members in order to work on their objectives and priorities for the service. We are doing this because we've got many years experience, 10 years experience in running health information and advice services over the phone.
Pfizer Health Solutions have brought a lot of the background knowledge and expertise to bringing to life the Birmingham OwnHealth service. From a lot of experience we had in the US of building and developing these sorts of programs, we brought that approach to the UK and have really developed something that fits, the UK requirements, fits with the NHS and will help to what the NHS is trying to achieve. Part of what the NHS benefits from, I think, in this kind of work is having some fresh thoughts and fresh ideas, and part also, I think, of what we bring to this is a different approach, something that our colleagues in the UK can work with, can make work for their particular local populations.
What's happened in the first year is, in simple terms, people feel better, their clinical metrics have improved, so their blood pressure's gone down to acceptable levels, their cholesterol level has gone down within acceptable levels, and for people with diabetes, their glucose HbA1c has also gone down to levels that are far more acceptable and will avoid them having an exacerbation of their condition in the future.
We're able as care managers to provide the patient with more time than perhaps the GP and other service providers can give. So if a patient wishes to talk about something sensitive, say for example a weight issue, we can give that little bit of time to look at barriers and hopefully work our way towards how we can improve it. It's looking at behaviour, looking at lifestyle changes.
It was something which usually was missing from my visit to GP. They are good doctors, I know, but perhaps they don't have that much time which was needed. And I think for me, joining Birmingham OwnHealth was a positive step in my life, which changed my lifestyle, brought me a little bit more self-confidence in myself.
As a GP, there's a lot of benefit from having a care manager who can tailor, for instance, the time of day they phone the patient the most convenient for them. Having more time to spend means that patients engage more. I can think of several patients who I have found personally very difficult to establish a rapport with. The care manager has succeeded where I have failed. Very often they then will advise the patient to come in and see us. Where we might have been struggling, they have succeeded to get the patient in.
My symptoms are quite under control. First thing which unknowingly noted last time about 2-3 months back was that my visit to emergency department has been cut down. My visit to my GP for common things has cut down, and feeling that I'm involved in something which is helping me, feeling that people are valuing me back.
I would argue that actually Birmingham OwnHealth is an example of world-class commissioning. If you actually look at the set of competencies that have been produced for world-class commissioning, we can actually align Birmingham OwnHealth to that. So, for example, the service was based on a need, an identified need. It was also about bringing in new providers such as Pfizer Health Solutions and NHS Direct. The providers are providing the whole pathway of care instead of the PCT commissioning bits of the pathway and then trying to wire all the pathway together. And again, the outcomes measurement is a really good example of we can demonstrate this has made a major difference to the 2,000 members that are in the scheme.
Well, in the long term, what we hope to achieve with this service is to broaden it and extend out the coverage in Birmingham East and North, and that's something we're going to be doing over the course of the next 3 years. We have a goal of getting to around 30,000 members of the service. What we also hope to do is to work increasingly closely with Birmingham City Council on the adults and community services here to try and provide a more coordinated and joined up health and social care support system for people with long-term conditions. In time, if we're successful in doing that, what I hope we will also get the opportunity is to look to develop that further around the West Midlands and then around the rest of the UK if we can.